LeadingAge Minnesota Foundation has always recognized that many people living and aging in rural Minnesota face increased risks and health disparities due to a lack of physical, emotional, and social resources that support health and well-being. Another critical resource scarcity in rural Minnesota is people. The people who can support older adults as they age. We are facing a demographic drought due to a perfect storm of retiring baby boomers, historically low rates of prime age workers, and limited immigration.
In the midst of the rural resource dilemma, an emerging paradigm shift is taking hold that will transform how people age. By 2025, it's estimated that up to 25% of the total cost of care for Medicare beneficiaries could shift from traditional care settings to receiving care and support at home. Successful adaptation to this shift will require cross-sector partnerships that offer care across the full continuum of need, not just medical, that harness technology and data in ways that enable new models of care and connection, paired with new payment streams that incent person-centered care and support regardless of setting. Fortunately, there are currently 3 and soon to be 5 rural communities in Minnesota stepping up to this new paradigm by creating exciting and integrated community ecosystems that support older adults and transform the rural aging experience. These communities are taking an asset-based approach to building relationships and connections that bridge existing and foster new resources to support people's physical, emotional, and social needs as they age.
The voices in this video highlight the cutting-edge, paradigm-shifting work of the 3 connected community pilots. Each pilot is founded on partnerships across community and clinical resources to engage, connect, and share resources with each other and community members.
The pilot projects are Elevate in Perr, Minnesota, serving northeastern Otter Tail County; Lakes Area Connected Communities in Alexandria, serving the Lakes Area region, Douglas, Grant, Pope, Stevens, and Traverse counties; and Encompass Aging Solutions in Redwood Falls, serving Redwood and Renville counties.
There's sometimes a perception that people that live on reservations, tribal communities, rural Minnesota in general, are somewhat exiled here, but the truth is we choose to live here. I mean, we choose to work here, raise families. Our needs continue as we age, and we want to make sure that we are meeting them for our citizens.
There are over 10,000 people turning 65 every day. From a healthcare standpoint and a community standpoint, there's the recognition that we don't necessarily have enough services, enough bricks and mortar, enough people to help them through their aging process in a traditional way.
60 years ago, every community had a hospital. 30 years ago, every community had a nursing home. Now we're having to rethink how we take care of older adults. One of those options is to collaborate. How can we work together as a society, as a community to do that? And that's what's so vitally important about this program.
Often we can be in silos and not even know the services each other provides, much less our community members.
What's transformational about connected communities is bringing more of a coordinated approach to care, making it easier for seniors to access care. It encourages really understanding the needs for the senior. Best benefit by having more services wrapped around them.
It is incredibly important that each participant at the table step outside of the silos that they normally work in and start to think about the community as a whole, including the quality and the financial picture together.
Encompass Aging Solutions will help coordinate services and work with seniors and their families to help them navigate services that are in the community that they live in. Having a mom myself who is 89 years old living in her own home, it's hard to navigate where to go for services in the home that you didn't need before.
It's really a matter of what do we need to highlight and what do we really need to change and where are our gaps and how can we help to fill those.
So through Connected Communities, Canute Nelson offers a variety of different services. We use technology as part of our program that involves a vital care tablet that can be used for a variety of different wellness purposes. We've also started offering Pearls, which is the program for encouraging active and rewarding lives, and that really helps people to kind of take charge of their lives and do more of the things that bring them joy.
We go into the clients' homes and set small attainable goals. With those goals, we really just help the individual thrive from where they're at and where they can go.
Making a true change requires trust, and trust requires time and familiarity. Knowing them as a person really helps us to approach problems in clinic in a way that will get them to buy in and ultimately improve their health over time.
Elevate is a health and wellness initiative that will give people an opportunity to live their best life, whether that is through a health coach that we have in our local healthcare facility or attending some of our social events. There is something for you within this program.
We had spent a lot of time talking about transportation, and we just decided to say, let's just buy a van and see what happens. And we're getting people to these doctor's appointments that they weren't able to get to. You're getting people to come to events that we're hosting that we never would have been able to come in the first place.
The older population, we run into so many not being able to drive any longer, needing that transportation. The Elevate van, it is really amazing.
Elevate is getting my elderly patients back into the community, which is beautiful. That's what we need. Social interaction is an amazing thing for all.
I have a good friend who's having some memory loss. I try and take him out once or twice a week. I did it on his behalf, but I'm finding that I'm benefiting too by just meeting other people my age and connecting.
I've gotten to do a number of Elevate activities recently. It's helped me get myself out of the house because it's easier to just stay home. So it's just been helping me get back into the live stream again.
Well, when I first read about Pearls, right away I thought that was a good thing for me. I tend to isolate a little bit. I found that when Nicole came over, I was really excited to see her, and it was not only helpful for me, but it was fun. The most effective part for me was helping me with anxiety and depression. I think it's an incredible program. People need this kind of thing.
When my husband was home, I was his full-time caregiver for 3 years. Connected Communities came to us. It meant a whole lot because my husband loved people, and so it was nice to have someone come out to our home. It gave him something to count on every day. I'm not the type of person that reaches out to people very easily, so for me to reach out to someone and then for them to reciprocate that and just be there when I needed them, and for me to be able to visit with healthcare people, it was invaluable because I had no support before that.
So this program was an eye-opener for me personally. Being a previous home care nurse manager, we were very focused on regulations and statutes we had to follow. It was cookie cutter. Within this program, we're really able to dive deep into what the client and families need to live out a healthy life.
And not everyone needs or wants the same service at the same time, and we have to be able to pivot based on what people need.
We're lifting up the entire community. That program really is focusing on the needs of the here and now of the population we have. We're still growing and we're still coming up with the things that we want our program to be, but that doesn't mean that we should wait. The time is now to see people come and tell us that they're really happy that they have somewhere to go, or that this is the reason that they're out of the house today. And I think that's really the true goal of the program.
There is a significant emotional, social, and medical cost to social isolation and aging. The fact that the project worked on the social drivers of health as much as the medical care brought this to be an opportunity that I really believed could make a difference in the communities that were selected, and ultimately something that could be engaged in other communities in the state of Minnesota and even be a national model.
I have worked in senior care my entire life. I know the power and the role and the importance that senior care communities play, especially within rural communities. You are often that last opportunity for a person to remain in their community of choice.
For our senior care organizations, I say advocate for yourselves, advocate for the people within your community, and find new avenues.
The programs that we have offered have been having
wonderful results that have enriched the lives of the clients that we're serving.
When people have more help, they can live in their home for longer and they can enjoy life a little bit more.
We'll all be learning, and the results of that learning would allow for real changes in the service delivery model that can be operated in rural areas of our state.
Why wait till tomorrow? These things are needed right now in the communities. Someone who lives in this community, I want to be able to age here too.
It is super fun to get out into your community and figure out what's out there. We just literally started walking the streets and learning what was out in our community and started making connections between various entities that already exist in our community.
We couldn't do the work that we're doing without partnerships within our community. They will help you create programs or events and places for people to go. The main thing that I would say and I would stress is you have to start. Just start somewhere. What feels right?
Start having a conversation. Start collaborating. Work with organizations you worked with in the past or organizations that are committed to your community.
You know, you can come visit Elevate, look at everything we do, look at every program of this type. You know where the gaps are, and more importantly, you know the culture of your community. Some things we do won't work, and some things that we didn't even think of will work. And so learn from all of us. Take whatever you want, but make it really unique to your community.
If we're not making change, then change will eventually be dictated to us. We're happy to be leading the way and demonstrating what it can look like when we all come together.